This is Health Matters, a podcast from Mayo Clinic where we discuss the latest medical advice, news, and research to help you live a happier and healthier life. My name is Kristen Meinzer. I'm a writer and journalist, and this episode, we're talking about the thyroid. Roughly 20 million Americans already have some form of a thyroid issue, and it's estimated that over half of them are completely unaware of it. So this episode, we're going to focus on understanding the thyroid. What is it? And what does it do? We'll also look at the role the thyroid plays in the much larger endocrine system. We'll dig into all that and more with our guest, Dr. Mabel Ryder, who works at Mayo Clinic in Rochester, Minnesota. There, she practices within the endocrinology department and the Mayo Clinic Comprehensive Cancer Center. Dr. Ryder, welcome to the show.
Thank you, Kristen. Glad to be here.
We are so excited to talk with you today about the mighty, mighty thyroid. It's a term that a lot of us are familiar with, but may not fully understand. So let's start our conversation by just taking a holistic look at the endocrine system first. What is it, and what role does the thyroid play within it?
Yeah, great question, Kristen. A lot of times, endocrine and hormones, especially thyroid, may be a black box or a lot of myths and misunderstandings. So if we think about the endocrine system, that's characterized by specific organs or glands that make hormones. For example, the thyroid gland makes thyroid hormone. We have the adrenal gland that makes adrenal hormones. We have our ovaries for women or testes for males, which make our sex hormones, estrogen and testosterone. And we have other glands, such as the pituitary gland, and it's sort of the master regulator of most of our other endocrine glands that I just mentioned. So the endocrine system working together helps make sure vital parts of our system are working, our heart, our lungs, our kidneys, liver, helps us feel well, and general health.
Now, you use the word glands a lot there, and some of us honestly don't really understand what glands are. Can you explain?
When we refer to endocrine glands, we're referring to an organ or a group of cells that are specialized to make and secrete hormone. So there's the thyroid glands, the pituitary gland, the adrenal glands, the ovaries, and the testes. And these are specialized cells, again, that make specialized hormones. These hormones go into the blood system, and then they disperse and act in other parts of the body generally.
Now, speaking of the thyroid, what exactly is it and where is it in our body?
The thyroid gland is a specialized organ that sits in the neck. And there's 3 different lobes. There's a right lobe, a left lobe, and a middle lobe called the isthmus. And it kind of looks like a butterfly. And it sits in the middle of your neck behind what we call the strap muscles and in front of your windpipe or your airway. And it makes thyroid hormone. And that's in the form of what we call T4 and T3.
You've mentioned hormones, and when we think about hormones, it's oftentimes the case we're only thinking about sex, reproduction, and so on. But you're saying hormones are much bigger than that. Can you explain what exactly hormones are?
Hormones are the type of protein that's made within an endocrine organ or gland, such as the thyroid or the adrenals. That hormone gets secreted typically into the blood supply. And that hormone travels through the blood supply to other target sites distant from its own organ, typically. And then that hormone has different ways of getting into the cell. But then these hormones have receptors, and these receptors then turn on different functions when they bind to their specific receptor. And that function could activate a certain pathway inside the cell, or as in the case of thyroid hormone, it may turn on DNA functions or genes that then regulate that organ, such as the heart or the liver or the muscle.
And what are those hormones for? What are they doing?
Thyroid hormone affects nearly all cells and organs in the body. So T4 and T3 help the heart work well. They help the liver, the muscles, They regulate motility in our gut. They regulate body temperature, body composition. They may affect our metabolism, and it affects our brain as well in terms of cognitive function. All of the organs in our body require normal or good amounts of T4, T3 in order to work properly.
So we want our thyroids to function well in order to do all this work. Can you give me an example of what the thyroid is doing when it's functioning well?
For the most part, thyroid hormone makes two different hormones, T4 and T3. T4 is what we call a prohormone. It's not active, but it gets converted to T3. And T3 is the active hormone in our body. That's what all the other cells need to respond to thyroid hormone and to function. And so the thyroid is kind of neat in how it's developed because the thyroid invests most of its energy in making T4, 70 to 80%. That T4, however, lasts for about a week in your system. But that T4 gets converted to T3, the active hormone, slowly in a steady state level. Whereas the T3, the active hormone that gets secreted, only about 10 to 20% of that comes from the thyroid. Most of it comes from T4. So in that way, the thyroid is continually making a steady state amount of T4 and T3 throughout the day. And that helps keep a steady state level of hormone. There might be minor peaks during the morning or evening or at bedtime. But for the most part, in most patients with normal thyroid function, we have good regular amounts of T4, T3 to allow all the organs to work well.
Got it. So if I'm understanding correctly, T3 is the more active version of the thyroid hormone.
Yes.
And T4 is the more passive version that eventually evolves into becoming T3 as needed.
Correct.
And you mentioned that the thyroid hormone, or T4 and T3, affects nearly all cells and organs in the body. Can you tell us more about just how significant T4 and T3 are?
The thyroid, by making its T4, T3, is how it reaches and ensures other organ systems, such as the heart, works well. So T4 converted to T3 helps regulate the heart rate to some extent, and it helps with the contraction ability of the heart. So by making T3 and keeping that at a steady state level, it encourages or helps supply the heart what it needs. If T3 levels or thyroid hormone levels are not normal, that can impact the rate of the heart, the contraction ability of the heart. Likewise, it can affect the gut motility. In order to have good gut motility and absorption of our food, we need ideal amounts of T4 and T3.
So our thyroid hormones are really doing a lot of work all over the body in systems that maybe at first glance don't even look like they're related to each other.
Correct. So we often talk with patients about the important functions of the thyroid. And because it impacts all organs, when the thyroid is not normal, you could have a variety of different symptoms. And that's why when you look up abnormalities or symptoms of abnormal thyroid function, there's a big list of possibilities. And that's because all of the organs respond to thyroid hormone, but in different, unique ways.
So the endocrine system is full of glands which make and secrete hormones that then circulate in the blood system to send messages to other parts of the body. One of those endocrine glands is the thyroid gland, which makes thyroid hormone specifically in the form of T4 and T3. Think of T4 and T3 as a double act. T4 is kind of like the backstage crew that sets up everything and makes sure the show is all prepped so it can run smoothly. T3, on the other hand, is like the lead performer and the one that steals the spotlight. T3 puts in only about 20% of the work, but drives most of the performance. It's important that we get a steady state supply of thyroid hormone because it affects nearly all cells and organs in our bodies. A steady state supply helps the heart, the liver, the muscles, and also our gut motility to function well. Thyroid hormone also plays a role in regulating our body temperature, body composition, our metabolism, and even our cognitive function. Now, Dr. Ryder, you were starting to broach the subject of thyroid problems, and I want to dig into that because that's oftentimes when most of us hear about a thyroid is somebody's having a thyroid issue. What are some of the common issues that can go wrong with a thyroid?
So, autoimmune thyroid disease is one of the most common autoimmune diseases in general. And that's a spectrum. The most common autoimmune thyroid disease is what we call hypothyroidism, caused from Hashimoto's.
Mm,
Hashimoto's is a term for an autoimmune condition where our immune system is causing or has caused damage and destruction to these thyroid cells and impairs their ability to make thyroid hormone. And so a patient can become underactive or hypothyroid, as we call it. The opposite spectrum that's also common is what we call autoimmune Graves' disease or hyperthyroidism. And
mm,
that's where the immune system has made an antibody that is acting like the gas to the thyroid, and it tells the thyroid make more thyroid hormone. And so that's hyperthyroidism. And both are fairly common across the population.
And when we hear about them, it's often with regard to metabolism or weight gain or weight loss. Is that primarily what's happening there, or is there more happening with these diseases?
So, weight may be one of the easiest manifestations to recognize of abnormal thyroid function. Patients who become very hypothyroid, whose T4 and T3 levels are quite low, will often report some degree of weight gain, either small or significant amount. And the opposite, patients whose thyroid is making too much thyroid hormone because of Graves' disease and these stimulating antibodies that tell the thyroid make lots of T4 and T3, those patients typically have quite a bit of weight loss. But there are other symptoms. So patients with hypothyroidism may be cold intolerant because their body temperature or their metabolism has been affected by low T4 and T3, whereas patients with overactive thyroid may have heat intolerance. So they might feel very hot when the rest of us are quite cold in
Mm.
minus 10-degree weather here in the Midwest in the winter. And the heart is another common organ that's affected when a patient who's underactive with their thyroid might actually have a lower or slower heart rate. Whereas when somebody is overactive, they might have palpitations and feel like a very rapid heart rate.
Got it. So it's a lot more than metabolism happening here.
Correct.
On the flip side, in our weight loss obsessed culture, I've heard people joke, oh, I just wish I had an overactive thyroid. I wish that I had metabolism that was out of control and that my thyroid just wouldn't quit. What do you say to people who joke about that?
So it is true that an overactive thyroid, such as Graves' disease, can lead to weight loss,
Hmm.
but it leads to a lot of other potential harm, primarily to the heart, to the bones. So when we see patients with Graves' disease, which is an overactive thyroid, we treat them so that they don't develop more serious complications.
What kinds of effects on the bones and the heart and so on would an overactive thyroid cause?
Overactive thyroid can cause bone loss and can lead to what we call osteoporosis and risk for bone
Oh,
fractures.
wow.
And then overactive thyroid can lead to an abnormal rhythm in the heart called atrial fibrillation. And that is a risk for very fast heart rate and a risk for stroke based on that type of heart rhythm.
And what about the underactive thyroid? Is that also doing things to my bones and heart?
Underactive thyroid can cause a low heart rate. It can decrease the contraction ability of the heart. So it could impact cardiac function, leading to heart failure in extreme cases, and probably doesn't impact the bone to the degree that the hyperthyroidism impacts the bone health.
What about goiters? Goiters is something else we hear about when we're talking about thyroid health. What are goiters? What's happening? What's the cause?
Typically, a goiter is a term that is generally used for an enlarged thyroid. And there could be a lot of reasons for an enlarged thyroid. In areas of iodine deficiency, that may be the most common reason for a goiter or for an enlarged thyroid. And that's why we often have iodized salt and iodinated food so that we can have enough iodine in our system to be able to keep a healthy thyroid. In other cases, an enlarged thyroid or goiter could be from nodules, could be from inflammation, such as may happen in Hashimoto's. And it could be just nodules, benign nodules that happen in the thyroid.
By benign nodules, you mean like benign growths.
Yes.
And what about thyroid cancer? Do we know anything about what might make somebody at risk for that?
Thyroid cancer is surprisingly common. Fortunately, it's most often small indolent cancers that we're finding today, most often incidentally, but there are other small percentage of patients with more advanced cancers. Risk factors for thyroid cancer have been prior radiation exposure. So, for
Hmm.
example, in the Chernobyl nuclear power plant disaster, that was a risk factor we learned for thyroid cancer, particularly in children who were exposed to the radiation at the age of 5 and under.
What other risk factors might make us more likely to develop thyroid issues?
Primarily, likely genetics. So, if you have a family member, a parent, or a sibling who has autoimmune thyroid disease, that may make your risk also higher for autoimmune thyroid disease.
Hmm. What warning signs could be alerting us that we might be having some thyroid issues? What should I be looking out for?
Patients ask me this question quite often, and sometimes it may be hard because the thyroid affects all the organs in our body. You could have a number of different symptoms, which could be suggestive of thyroid. But symptoms could be, as we started talking about changes in heat or cold intolerance, feeling really cold when everybody else is warm, or feeling very hot when everybody else is cold, having palpitations, not sleeping well, change in your weight, either weight gain or weight loss. These are sometimes the typical symptoms that patients may come to us with asking, is it my thyroid that's causing this?
And when do I know it's time to actually consult with a doctor about my thyroid?
I think if you have a change in your baseline, it's something that's very different and you just feel off, especially if there's a higher risk based on your family history. I tell patients check with your doctor and ask, should I check my thyroid?
So, we're talking about how changes in your weight, not sleeping well, these can be signs of something being wrong with your thyroid. But how can you tell if what you're experiencing is just, a normal fluctuation versus a more serious issue that needs a doctor's consultation or proper diagnosis?
Yeah, great question. Because throughout any given day or week, we might all have times where we're feeling tired, or many of us gain weight as we get older. Is that normal? Is that
Mhm.
abnormal? And heart palpitations could be from a lot of different things. And I think most patients, when they develop thyroid abnormalities, it may actually also be a gradual process. And they may actually get used to the symptoms over time, especially when we're young. And so patients may write their symptoms off as, I just didn't sleep well, or I'm just working too hard. So I think if symptoms are ongoing and progressive, it's always a good idea to check it because it's easy to assess the thyroid function with a simple
Mm.
blood test. And if it's normal, then that's reassuring. And maybe it is other factors or something that with a tincture of time could get better. But if the thyroid levels are abnormal, then it's certainly something that could be impacting their health and can be intervened upon. So while most people might develop a gradual onset in symptoms, some are more rapid onset, especially with Graves' disease. It can be within a month or two of developing symptoms, whereas hypothyroidism most often is a gradual process. And it may be hard to know, is this just my norm and a fluctuation, or is this something that's thyroid related?
It never hurts to go to the doctor if there's suspicions, is what it sounds like.
I think if symptoms are ongoing and not improving and you want to rule out the thyroid, it's fairly simple to do it. Obviously, you have to have access to a doctor and to labs. And if you check thyroid function with that blood test, that provides a lot of reassurance on potentially what it's not related to or what it could be related to.
When it comes to issues with the thyroid, there are two main autoimmune diseases. The most common is hypothyroidism, caused by Hashimoto's disease, where the immune system causes damage and destruction to thyroid cells, impairing their ability to make thyroid hormone. Patients who become very hypothyroid with low T4 and T3 levels might experience weight gain. They may also be cold intolerant, feeling very cold when everyone else around them is feeling hot because their body temperature or their metabolism has been affected. They may also have a lower or slower heart rate. On the other end of the spectrum is hyperthyroidism, sometimes associated with Graves' disease. And that's where the immune system has made an antibody that effectively tells the thyroid to make more thyroid hormone than normal. Patients with hyperthyroid might experience palpitations and a rapid heart rate. They may also have heat intolerance. There can be other issues with the thyroid, like goiters. These can be a result of iodine deficiency, nodules, or inflammation. Thyroid cancer is also surprisingly common and can be the result of previous radiation exposure. Now, genetics is one of the main indicators or risk factors for thyroid issues. So if you're sensing that something is off base, maybe you're experiencing fluctuations in your weight, your body temperature, or your heart rate, and especially if you are at higher risk because of your family history, go and visit your doctor to see if you're experiencing a thyroid issue. So let's talk about diagnosis and treatment. Let's say somebody out there, they're feeling some symptoms that are troubling them. They go to the doctor and they want to know if it's a thyroid issue. What is the doctor going to do at that point?
So the doctor will likely examine their neck and feel what the thyroid gland feels like. Is it enlarged? Is it not enlarged? Is it tender? They may ask questions about specific symptoms and how long they've been ongoing. And ultimately, because the thyroid can impact so many organ systems, it's hard to say whether it is or isn't thyroid by just a physical exam or by just a history and symptoms. Symptoms can very much overlap with what could be thyroid or may not be thyroid at all. And so in most cases, the doctor will check a blood test, and that blood test is called TSH. It stands for thyroid stimulating hormone. And it's a very reliable hormone because in probably 95% of patients, when it's normal, it reflects good, intact thyroid function or normal thyroid hormone levels if a patient is on replacement with thyroid hormone already. In about 5 to 10% of patients who may have a pituitary problem, the TSH alone may not be reliable, and so sometimes we'll check a TSH and a free T4. With both of these tests, we're able to assess in majority of patients whether there's any abnormal thyroid function. And if there is, whether it's at the level of the thyroid or less commonly at the level of the pituitary.
So if you are one of the people who comes back with an abnormal thyroid test, what should I expect my doctor to do then to help treat that?
The first step will be to analyze that abnormal thyroid test and characterize it as either is it an underactive thyroid or is it overactive? A borderline TSH that's mildly elevated, we may not treat initially because symptoms may not require it or symptoms may not get better. But in patients with an underactive thyroid, the TSH will be high. In most cases, we would assess what the cause of the hypothyroidism is. And if we can measure thyroid autoantibodies, and if those are consistent with Hashimoto's, then this generally indicates a long-term chronic destructive process of the thyroid where the thyroid is not going to recover or be able to maintain normal thyroid function. And that's generally irreversible, at least at present. Future science may change that. And the level at which we start a patient on thyroid replacement is a TSH typically between 7 to 10 or higher. And that's a pill called levothyroxine or Synthroid brand.
And is that a daily pill then that somebody takes for a short time or for the rest of their life? How does that work?
Patients with high TSHs due to Hashimoto's, it would be lifelong thyroid hormone replacement. And that typically occurs with a pill treatment once a day, usually in the morning before they eat their breakfast, about 30 minutes.
And what about the case of an overactive thyroid? What type of treatment is there in that situation?
In some cases of an overactive thyroid, say from Graves' disease, or there's a nodule within the thyroid that misbehaves and is making too much thyroid hormone, there are different treatment strategies. So for Graves' disease, it might be medications to lower thyroid hormones. It might be radioactive iodine to get rid of the thyroid with a small dose of radiation. Or we might do surgery to remove the entire thyroid or that hot nodule or that nodule that's misbehaving. And that helps resolve the overactive thyroid. And those patients after surgery would then go on thyroid replacement, but at a controlled normal level.
Mm. How well does that thyroid replacement work? Because when you say, oh, the whole thing gets removed, I get a little scared about that.
I would say from a biochemical standpoint, thyroid hormone replacement is straightforward. It's a bioidentical hormone. That means it's similar to the hormone that your body makes. So
Mhm.
there really are no side effects from levothyroxine or Synthroid replacement. And as long as you're on a dose that keeps your TSH normal, thyroid function is essentially normal. And ideally, that translates into most patients feeling very well and functional.
That's great.
That is great. We do, however, at Mayo Clinic see a lot of patients on thyroid replacement who don't feel well on replacement. And that's a challenging situation. And patients often wonder, is it because their thyroid hormone is not doing its job? Even though the blood tests are normal, TSH is perfect, they're on the right dose, they don't always feel well. And the challenge there is that their symptoms may not be related to the thyroid, but they certainly overlap with some of the symptoms they had before.
Now, when patients suspect it's still my thyroid, I think my thyroid is causing me some problems, and you say, no, it's not, what else might be causing those issues?
So we often talk with patients about their health and their symptoms as potentially a puzzle, and there's many pieces to that puzzle. Thyroid is but one piece, but there may be other things such as could it be anemia? Could it be vitamin deficiencies? Could
Mm.
there be other organ systems such as their heart or their lung function that's not optimal? Could it be lifestyle? Could it be their weight itself that's causing, for example, fatigue? Could they have underlying mental health disorders such as anxiety or depression that could be causing some of their poor quality of life? And while I may not always know those answers, what I like to encourage patients to do is to look for other possibilities besides the thyroid once we confirm that the thyroid function is good based on that blood test.
Mm. That's fascinating that something can, in our minds, be presenting as if it's this one thing, but the test will show it's another. And I'm sure for some patients that's frustrating, but in another way, it must be a relief to know we are eliminating this problem and now we can look at these other things, right?
Yes. So it's challenging when a patient doesn't feel well. And my role as a physician is to try and help. I want to help them feel better and get better. But as a thyroid doctor, I don't always have those means when the thyroid function is good. And so there is some disappointment when I say there's limitations in what I can do for you from a thyroid perspective based on your normal levels. They were
Yeah.
hoping that there's another thyroid solution. I'd have another prescription or remedy from a thyroid perspective. But I do by providing them with education and by encouraging them to look for other reasons. I think that is an important step for them. And many patients are both disappointed but also reassured.
Okay, so we talked about how the thyroid kind of exists in this black box, where there's sometimes a lack of information about it, or on the other hand, a lot of misinformation. I'm curious, what other kind of misconceptions do you hear from your patients when it comes to the thyroid?
Hashimoto's is the autoimmune condition that leads to an underactive thyroid.
Mm-hmm.
And when the thyroid is underactive, which we define as a high TSH, typically greater than 7 to 10s, that's when symptoms may arise. Once you treat the high TSH with levothyroxine and your TSH comes back to normal, there's no further implications of the Hashimoto's in terms of symptoms. So even though your antibodies will remain high in Hashimoto's, they don't cause the fatigue, the weight gain that came from the high TSH, which came from low T4 and T3 hormone levels. Once the hormone levels go to normal, those antibodies are there, but they're not functioning to make symptoms. People ask commonly about Hashimoto's, and they're convinced that those antibodies cause symptoms. So that's a big misconception. They don't tie the Hashimoto's to high TSH, they tie it to the symptoms.
Mm. So at that point, it's not the thyroid that we should be looking at anymore.
Right. But because patients often struggle with fatigue and weight gain, inability to lose weight, and because they've done workup and all the other organs are working normally, they're convinced it must be the thyroid.
Mm.
They often read on the internet and it says a lot of different things, some completely false, that it is your thyroid, it is Hashimoto's. And so patients go down a path,
Mm-hmm.
and then it's hard for them to understand why it isn't their thyroid.
What other kind of misconceptions do you hear from your patients?
So there's degrees of hypothyroidism, and that can be a source of misunderstanding for patients. When we as an endocrinologist see a patient who's hypothyroid, those TSH levels are often very high, 50, 80, 100, or 200. And when we see patients with those types of TSH levels, those patients will often say they have cognitive changes. So they have trouble with their memory. They may have trouble with concentration. They may be very fatigued, sleeping quite a bit, in addition to gaining weight and feeling cold. And we often improve those patients' symptoms. When we take their TSH from 100 or 200 or 300 at extreme cases and eventually get them to normal, that patient feels remarkably better. On the other hand, we sometimes see patients whose TSHs are just mildly elevated, 5s or 6 or 7s. To an endocrinologist, while that is elevated, it's very mild. To the patient, where the levels might be up to 4, they think that's very high, understandably. But I try to explain to patients that even if we start them on replacement, the important thing to understand is their symptoms, unfortunately, may not change because it is a very mild elevation in TSH that either may get back to normal or stay mildly elevated, eventually may go up, so it should be monitored. But there's degrees of hypothyroidism and there's degrees of benefit then from thyroid replacement, where there may be minimal benefits when the TSH is only mildly elevated to dramatic benefit when the TSH is very high.
And is it the same with hyperthyroidism? Are there degrees?
Yes, yes. Almost all forms of hyperthyroidism will have a TSH that's near zero or at zero, but the level of T4 and T3, how high those are, may be even normal or maybe off the charts high. And so that will mirror the degree of symptoms and the degree of improvement once you treat those overactive hormone levels.
Got it. I feel like I'm finally getting a grasp on all of this.
Good. So then I've done my job today. Thanks, Kristen.
For those of us who just want to keep our thyroids happy, what advice do you have for us to make sure our thyroids are chugging along as they should be?
So I think having a healthy diet, good exercise is important. As data emerges, we want a healthy immune system, and whether that can help impact our propensity or likelihood of getting thyroid disorders may or may not, but I think it's important for overall healthy well-being. We all do need a little bit of iodine in our diet. That's important because the thyroid does require iodine in order to make thyroid hormone.
Can enlisting these behavioral and lifestyle methods actually work to reverse hypothyroidism or hyperthyroidism?
I wish I could say I have data or science proving that, but I don't think that exists to this day. But I think after seeing lots of patients in the clinic with lots of different symptoms and struggles with quality of life, with energy, with brain fog, and often with weight, I have come to understand an important part of our overall wellness is diet and exercise. And if we can focus on that, whether it impacts the thyroid function or reverses it or not, does improve quality of life overall.
This has all been so helpful, Dr. Ryder. Thank you so much for joining us today and explaining everything.
Thank you for having me.
If you're concerned you may be experiencing an issue with your thyroid, make an appointment with your doctor. It's likely they'll order a blood test called a TSH to see if your thyroid hormone is at normal levels. In a few special cases, some people may need an additional test, the free T4, to see if your issues are at the thyroid level or, less commonly, at the pituitary level. In the case that you receive an abnormal thyroid test result, the next step is to determine, are you experiencing an underactive thyroid or an overactive one? An underactive thyroid will give you high TSH levels, and you might start thyroid hormone replacement in a pill form. In the case of an overactive thyroid, there are a number of options. You might take medication to lower your thyroid hormone. There's also radioactive iodine to treat the thyroid with a small dose of radiation. And you might even undergo surgery to remove the entire thyroid, or a hot nodule that's causing the issue, followed by thyroid hormone replacement as well. Now, when it comes to thyroid replacement, with the right dosage to keep your TSH levels normal, your thyroid function should essentially be good. And most patients do well after replacement, though there are some patients who, for reasons that aren't always clear, don't. There's still a lot to learn about the thyroid, and the field itself is still evolving. At the same time, there's a lot of misinformation online, so if you have any lingering symptoms or doubts, make sure to be in conversation with your doctor to keep them informed about your condition and to stay knowledgeable about all the latest treatment offerings. Okay, that's all for this episode. But if you've got a question or topic suggestion, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. Next time on Health Matters, destigmatizing HIV.
We have excellent data that's emerged recently that if you have HIV and you're on effective treatment and your viral load is controlled, then your chances of transmitting HIV through sex to a partner are essentially zero. They're so low.
For more Health Matters episodes and resources, head to mayoclinic.org/healthmatters. And if you found this show helpful, please subscribe and make sure to rate and review us in your podcast app. It really does help others find the show. Thanks for listening, and until next time, take care and stay healthy. This podcast is for informational purposes only and should not be relied upon as medical or legal advice. Always consult with a qualified healthcare provider for any medical questions. The appearance of any guest does not imply an endorsement of them, their employer, or any entity they represent. The views and opinions are those of the speakers and do not necessarily reflect the views of Mayo Clinic. Reference to any product, service, or entity does not constitute an endorsement of or recommendation by Mayo Clinic.